Talking tip with Dr. Nacho because I'm an amazing associate here who has been with us for 3 years, and she is leaving us. She is ghosting us. Where are you moving to?
San Francisco.
All the way across the country from New Jersey to San Francisco. But while she's been here, she's been awesome, helped us with patients, and learned how to talk to patients. So I usually give you a tip myself, but today, Dr. Alicia is going to tell you some of her favorite talking tips on how to communicate with patients. So you came here out of dental school and residency, and did you talk weird to patients at that time?
I did talk weird.
And over the past 3 years, we've taught you to talk a lot less weird, right?
Mm-hmm.
So what are some of your favorite things that you say all the time to patients that you want to help those dentists who don't get to work in our office? What should they go out there and say?
The first tip that I use very regularly is always let them know that our goal is to get them bacteria and infection free. So when they start talking about doing whitening and they have, extensive treatment they need, we always start off with, our goal is to get you bacteria and infection free first before moving on to the next steps for your treatment.
Love that. So bacteria infection free. What else do you say to patients?
Another thing we say is retire the tooth instead of extract. I think it creates more positive verbiage and doesn't go straight to the negatives right away.
Yeah, it makes the patient feel better. Instead of saying your tooth has failed, we need to extract it, it's time for your tooth to retire and be replaced. Much more fun. And give us one more.
Another thing that we do sometimes when we need to think a little bit more before finalizing the treatment plan, I'll say, let us do a little homework on your treatment before we, give you your treatment options. And I think this helps them realize that we are doing our research on the back end and trying to give them the most thoughtful treatment plan.
And I like that because it lets you get out of that hygiene exam, lets you get out of the new patient exam, because you can always say you can't unsay. You can always say you can't unsay. So you tell someone they need two crowns, benefit from 2 crowns, you come back with 3, they think you've made some sort of mistake. So I love that. Well, I want to tell you, Dr. Alicia, you came here, you're a pandemic age dentist, right?
Yes.
Out of your residency, you should be so proud of yourself, of how you have grown and how great you've done with patients. We're lucky that we got to work with you. Sad you're leaving, and hope you come back in just 2 or 3 years when your husband moves back here.
I hope so too.
Thanks, Alicia.